Psychoanalysis, the saint and the therapist. It is instructive, very educational to go into the topic because it brings up issues of compare and contrast between psychoanalysis and spirituality. And this area of psychoanalysis and spirituality is a very interesting area, very potent area, both from standpoint of conceptual development and technique of psychoanalysis. In one of my past lectures on psychoanalysis and spirituality, I listed out areas which are common to both. Some areas unique to psychoanalysis, some areas unique to spirituality, and what can psychoanalysis gain from spirituality, and what can spirituality gain from psychoanalysis. You can go through that lecture, psychoanalysis and spirituality. Today we will reflect upon a small element in that area of psychoanalysis and spirituality, focused on a very narrow focus on the two professionals who stand in respective areas, the saint in spirituality and the therapist in psychoanalysis. We'll focus our reflection on these two professionals, sort of representatives of the two areas. We'll go into issues of compare, contrast, and see what we gain from that discussion. What is common to psychoanalysis and spirituality is both deal with self-knowing and self-transformation. Common enterprise to both these arcades is the journey of self-knowing and self-transformation. Psychoanalysis moves largely on materialistic basis, on the technique of the Western psychotherapy tradition, while spirituality largely moves on concept and practices of ages of tradition in the East. Largely it is Indian spirituality, and essentially it is Hindu spirituality. Psychoanalysis essentially is based upon reason, insight, catharsis, reflecting, not acting, reality acceptance. Spirituality largely is based upon mystical sciences, yogic sciences, the theories of chakra in Tantra, and on deep-seated self-observation and self-transformation. Goals are different. For psychoanalysis, the goal is normal health. For spirituality, the goal is enlightenment. In a sense, psychoanalysis is like coming from -5 to 0, or at best from -5 to +2. And spirituality is to take you from +2 to +10. Maybe you don't reach plus 10, but maybe the best possible is plus 2 to plus 7. The representatives of both these areas, who are the central professionals of respective areas, are the saint and the therapist. And both have certain common things between them. Both of them help people in distress, largely in psychological distress, but both work very differently. There is a kind of confession in both the areas. People in distress go and make confessions to the saint. They also make confessions to the therapist. Both are, in that sense, confession facilitators, confession receivers, confession custodians. But the conceptual foundations are different. The saint is conceptually anchored on idealism, theism, and positivity. He is very clear about the purpose of human life. He is very clear about the technique to reach that goal. On the other hand, the therapist does not know what is the goal of the client, which the client himself has to find out. And it can be anything that the client finds out. The therapist also is not very sure about the purpose of life or the origin of the universe or the origin of life. The therapist often also is not sure which is the technique in its micro details to be used, or if more than one technique has to be used to help the person. So in that sense, the therapist is the more eclectic environment where he has to juggle into judgments and pick and choose of weapons in the armor. The saint, on the other hand, is very clear. He stands on a certitude. Both are, in one sense, father figures or mother figures. On both of them, omnipotent projections happen. Oedipal projections happen. Involving both are taboos of not crossing the line, and therefore the pleasure of transgression also comes in both cases. And in both cases, both of them have to control themselves in the face of strong counter-transparencies, strong projective identifications. And unfortunately, the two in the real world are on the opposite sides most of the time. And rarely we see the two working together in coordination for the benefit of any client. For a therapist trained in the Western tradition, holy is a heresy. For the saint, the unconscious complexes of rage of Oedipus, they are like devil's work. And usually both of them are attacking each other instead of enriching themselves from the other. As people, they are very different. One is a believer, The second usually is a non-believer, though some therapists are believers. The saint usually have a very positive outlook towards the ultimate goal of the individual or the world. Therapist either is non-committal, open, or pessimistic about it. The paradigm of the saint is a paradigm of theism, idealism, purposefulness of human life. The paradigm of the therapist is the paradigm of materialism, individualism, hedonism, and often pessimism, like in case of Freud, but not in case of Jung. There are some saints whose experiences challenge the world of the therapist. One good book in the area is the book by Sudhir Kakkar, Bad and Divine. And decades ago, there was a book on this subject, Psychosis and Mysticism. There was a book by Swami Rama, Swami Ajaya, and Dr. Rudolph Ballantyne, titled Psychotherapy East and West, a Unifying Paradigm. In that book, they went into this area of mystical experiences, which can be thought of to be psychosis by traditionally trained psychiatrists and therapists. But in fact, it may not be psychosis, it may be a very different entity, a very different set of events happening in the mind and a very different set of experiences in their origin and purpose. Swami Ajaya goes deep into this area of mystical experiences and psychosis. Psychosis is loss of control of the ego or disintegration of the ego, while mystical experiences happen when one transcends the ego. Occasionally, they may happen even if the ego is partly deactivated. What Winnicott calls very well the state of unorganizing, distinct from the state of disintegrating. Winnicott talks about these states of disorganizing and unorganizing. And unorganizing is a state of conscious deactivation, usually partial deactivation of the ego, without any damage to health, which is so necessary for the creative process, where the hold of reality has to be weakened for the creative imaginative process to happen. Sudhir Kakkar also talks about experiences of Ramakrishna Paramahansa. Often we see a picture of him with a finger raised up to the sky, and he is lost in the state of ecstasy. So what do you call that state? Do you call him mad or do you call him divine? Is it a state of psychosis or is it a heightened state of mysticism and spirituality? The therapist is unlikely to explore these realms of experiences. But for the saint, these experiences actually are the goal. and he is eager to explore this range of experiences. For the therapist, these states are pathological states. For the saint, these states are holy states. There also is a question of what is allowed and what is prohibited in the two areas of spirituality and psychoanalysis. Psychoanalysis is based upon the premise of reflecting, not acting. It does not go into the area of living it out, neither in the therapy room nor outside. Essentially, it is a reflective cathartic enterprise. Spirituality does not have these holdbacks. Psychoanalysis has many holdbacks. Spirituality does not have these holdbacks. Spirituality also makes use of living it out, especially more radical branches of spirituality like Tantra, especially the left-hand Tantra. Spirituality also makes use of tools like mantra, visualization, idol therapy, breathing exercises, herbal concoctions. Psychoanalysis does not use these tools, and therefore the basket of tools in psychoanalysis is very limited compared to a much larger basket of tools that spirituality deploys. So the saint has at his disposal a much larger basket of tools than the therapist has at his disposal. Does it help if a saint is trained in therapy or a therapist is trained in spirituality? Of course it helps. It enriches oneself, enlarges one's basket of tools, removes limitations of one's training and the conceptual world, and provides a larger landscape, a more holistic approach to helping people. A global holistic spiritual movement is actually already on. Unknown to the therapist, more often than not, clients are already seeking help of holistic healing practices outside of therapy. So even a therapist is not asking the client to combine the two, clients are doing it on their own. As we move along, this global holistic spiritual movement will only widen, strengthen, and deepen. In the next 10 years, I think it should be in the center of the mainstream. Universally pervasive. And in the future landscape, we should see psychoanalysis and spirituality both coming together, not fusing into one, remaining two distinct spaces, but being open to each other and enriching oneself from each other. And this will help us create a more comprehensive model of the mind, pathogenesis, healing approaches, and spiritual approaches. It is not that spirituality does not stand to enrich from psychoanalysis. We can see even the most accomplished of spiritual leaders with unresolved issues which a psychoanalyst can easily see. So in that sense, spirituality itself is incomplete without psychoanalysis. The saint also has to learn from the therapist, even as he has something to preach. Thank you.